Your free report is on the way. As you'll find in the report, there are many alternatives to Obamacare plans that can drastically reduce your monthly premiums and out-of-pocket costs. I'm going to outline two of the alternatives briefly in this short video. Hi, I'm Ron Wardell, and I've been a licensed insurance agent for 30 years. Before I get started, I want you to understand a couple of things. First off, who is this for? If you are not receiving a substantial tax credit from the federal government to help pay your premiums, if you're relatively healthy and pre-existing conditions are not an issue for you, and if you're just sick and tired of paying outrageous premiums and super high out-of-pocket costs. So, who is this not for? If you have a pre-existing condition or take multiple prescriptions or are receiving a substantial tax credit to help pay for your ACA plan. Additionally, if you're over 65 and on Medicare, these plans are not for you. Lastly, the report and this presentation are for education purposes only, and there is nothing to buy here. If after you watch this video you're interested in additional information, you can click on the button below and schedule a one-on-one conversation for more details. So, let's get to it. Why are these alternatives now available? Under the Tax Cuts and Jobs Act of 2017, certain aspects of Obamacare were removed or altered. I won't go into all of them, but you can search them on the web for more details. One of the main benefits was the removal of the Obamacare mandate requiring every individual to buy health insurance or pay a tax penalty if you decided not to buy or couldn't afford it. When the mandate was removed, it paved the way for policies to be offered that did not meet the required essential benefits provision of Obamacare. The first alternative is called short-term medical or temporary medical insurance. These plans mirror major medical plans pre-Obamacare. What does that mean? You have access to large networks of doctors and hospitals, or no network at all, which means you can choose any provider you like. There is a deductible provision, typically anywhere between $1,500 and $10,000. You choose. Then there is a coinsurance provision after you have met the deductible. So, for example, the insurance company pays 80% and you pay 20% until you reach a maximum out-of-pocket limit. Then the insurance company pays 100% of the expenses. The great thing about short-term plans is they are now available for up to 3 years, so not really temporary anymore. And the best part is they can cost between 50 and 67% less than an Obamacare policy, depending on where you live. The second alternative I'll talk about is a hospital indemnity plan. These plans cover you in the hospital, and the insurer doesn't care what the bill is. Why would the insurer not care what the amount of the bill is, you might ask? Because they pay a flat amount of money based on a preset schedule. For example, they might pay $3,000 a day for every day you're in the hospital, or $5,000 per day if you are in intensive care. They'll also pay based on the schedule for doctors, labs, x-rays, etc. So, what's the downside? Well, the payments may not be enough to cover the whole bill. However, the amount not covered may be less than the out-of-pocket expenses associated with Obamacare plans in some cases. So you need to understand and compare the benefits carefully, or consult with an expert. These plans are significantly less expensive than Obamacare policies. They also can be combined with other plans to reduce out-of-pocket expenses, again at a much lower cost than an ACA major medical plan. Many other alternatives are discussed in the free report you'll be receiving soon. If you're interested in more details on all the available plans, simply click on the button below and find out if you qualify. So go ahead and schedule a free one-on-one call right now.